You're watching the Eternal Beauty Skin and Laser channel, and today we are introducing our new cutting-edge procedure for face lifting. It's called NovaThreading. Am I correct?
That's correct.
And we have this beautiful young nurse
Thank you.
who has flown all the way from Los Angeles to train our staff. Welcome.
Thank you.
How do you pronounce your name correctly so I don't butcher it?
It's Neeti Masur.
Neeti. Neeti is going to give clear demonstrations today on how this procedure is done so that you can be satisfied and know it's a safe procedure and the best for naturally lifting the face. Am I correct?
That's correct. I'm excited to get everyone started.
How did you get started doing this? You're so young.
I started working for Dr. Karimi, and he's the medical director for this company, NovaThreads. So me being his nurse, he trained me to become a trainer and come here and teach you guys how to safely do this procedure.
So are you the company's main trainer?
Yes.
Okay, so tell us where you want to start today. What do you want our viewers to know? What's the procedure and how should we begin teaching them? We can start here.
So finding the ideal candidate would be the first step. Basically, someone with mild to moderate sagging in the lower 1/3 is a perfect candidate. And this is different than fillers. I just want to make that clear.
Okay.
Fillers is perfect for the mid-face because you're filling. Threads is really great for the lower 1/3 because you're lifting the tissues. But that being said, you could still use threads in different areas of the face and body.
So why would a person want to do this instead of fillers? Or would
Fillers is you're going to have an issue lifting that you can't lift the tissue. So when you fill in these lines, especially around the perioral area, around the jawline, that's not lifting. The threads are going to attach. They have little barbs that are going to attach to the tissue and immediately give you a lift.
Great. So people would still need fillers.
Yes.
Depending on what they're hoping to accomplish.
Yes, they accomplish different things. And together, fillers and threads is perfect.
So what do the viewers need to know now? After they know one is for lifting, one is for filling, depending on what the need is. So what's the next thing they need to know about this procedure?
It's safe. It's basically an immediate non-surgical facelift, and it's basically no downtime.
And how long does it last?
So it should last about 6 months, but it depends how many threads we decide to use and each candidate.
What type of side effects have been common? Because I know every product comes with a whole list of side effects sometimes. But which of those have you had complaints about based on the cases that you guys have already treated?
So some complications of threads would be extrusion. So the thread can come out of the insertion point, a little bit of bruising, and irregularity. Those are the most common.
And when that happens, what are we supposed to do if it happens to one of our patients?
So you want the patient to contact the provider first. If it's a thread coming out, so if the thread is extruding, you want them to come in and you want to pull out the thread. If it's just a little bit of irregularity with no pain, you want to just have them wait it out, and just like fillers, at 2 weeks, everything tends to settle.
Just pull it out? We just grab it and pull it out and it comes out?
Sterilely, but yes.
Oh, okay. It comes out that easily.
Yeah.
So you inject these threads and they lift the face. What happens to the threads at the end of 6 months when they need to be replaced?
So your body is going to dissolve the suture. So it's basically you're breaking up the thread, but that's inducing collagen. So it's healthy for you. So it's not like it's been a complete waste once the thread has dissolved. And then at that point, you just go back in and just like Botox and fillers, you want to do a little touch-up.
Please note she said it helps your collagen. And that's big because a lot of the patients who come in or customers who come in to see us, their concern is that their collagen has stopped. So you're accomplishing more than one outcome when you choose this procedure.
Exactly.
So you inject it lasts for 6 months, and we have to see the customers after they've been treated, and how often?
So I have all my patients come back at 2 weeks just to check up on them, see how everything's settling and healing. Then I leave it up to the patient, but I have them ideally come back at 3 and 6 months to assess how many threads we should or shouldn't add.
How long has this procedure been in the...
So it's been around for basically a year.
And what kind of feedback are you getting from the people that have had this?
It's been
procedure?
amazing results. It's been huge. People have been flying in internationally for this. They come in and then they walk out basically with a non-surgical facelift. It's been a very high success rate.
Great. So what are some of the treatable areas that have been approved by the FDA? It has been approved for all soft tissue areas. And we are going to be offering all of it here at Eternal Beauty Skin and Laser.
Threads really can be done anywhere in the body or the face. It is still the best for lower 1/3. We have, since the cannula threads have come out, been having great results with the brow lift. So you put a barbed thread right into the fat pad and it immediately is going to give you a brow lift. And also for the neck bands, people have been doing breast lifts, butt lifts.
Breast with this thread?
Yep.
Wow, that's really interesting.
Yes, and then the knee folds, you can do some long barb threads. So you can really get creative and do it anywhere in the body.
What are the common areas that you've treated since you've been on the market with this?
So my favorite areas to do threads are the brow lift, the mid-face. It's going to give you a little bit of volume as well as decrease the appearance of nasolabial folds as well as a lift. For the lower 1/3, it's going to just basically lift, which the lower 1/3 is really where it's difficult to use fillers. There was nothing really on the market before threads came out. So it is my favorite still in that area. The neck, that's been really popular.
Good. Are you excited to get started?
I'm excited to get everyone here started.
I am very excited to get started. So we are going to bring our first model, Sophia, to the table. And we will continue to show you how this procedure is done.
Okay.
So right now, what are you doing?
So right now I'm just going to give Sophia a block to make her threads a little bit more comfortable. So this is just plain lidocaine.
Like the dentist?
Mm-hmm.
So you gave her 4 shots?
Yeah, and then we'll do the same with the bottom.
Okay.
So you should start feeling numb pretty soon. So right now we'll just draw some vectors.
And what are the vectors?
So we're just gonna, if you could sit up for me, we're just gonna mark out where we're gonna have her threads go.
Okay.
It's 3.5 inches. So usually for the lower 1/3, I will come from right here. And then you just mark where the thread is going to be passing. So they should start to, they'll only feel numb in their mouth for about an hour. So you could tell your patients that feeling will go away in about an hour.
So right now you're numbing the area.
Just
so the
of the
viewers can
insertion
tell what you're
point.
doing.
Mhm.
Yeah. That's so when you insert the
thread, it's more comfortable and it's going to prevent, if you could turn a little bit to your left.
We are now inserting our first thread.
So these are cannula threads. Little poke.
You feel anything? Mm-mm. Piece of cake.
Yeah. Just a little tunnel. And then so we're at the final endpoint. Sorry. So I'm going to put 2 fingers, twist, twist, and then massage on the way out.
It's already changed.
Yep.
Can you see that? That's amazing. Wow. Just one.
Which is why I just do 1 thread at a time from top to bottom. Let's take a look, if you can sit up for us.
How many you think she'll need right there?
Let's see. So if you see the difference between her right and
that
left,
little
it's
gel is
already a
gone.
little bit. You want to see?
Wow.
Yeah. So I always have my patients look at one side. I always treat one side, have them look at the left versus right, because that's when you'll see an amazing result.
Did you have pain?
I don't need to go there for that one.
So I engaged the end of the thread, and then while pulling out, slowly massaging. All right, let's take a look. If you can sit up for us.
Smile.
But it
So that I'm very happy is absolutely tolerable, and the
And
result.
you look beautiful.
And I'm really happy, and if I'm happy because I'm really chicken and I'm very happy, and I have very sensitive, big sensitivity to the pain. If I'm telling that it's tolerable, it's really tolerable.
Awesome. That's what we want to hear. And you look different with
Thank
just
you.
with 2 threads.
Don't smile too much.